As we wrap up Season 1 of Connected, we're taking a look back at where Healthy Connections started, where we are now, and where we're headed. Our guest today is CEO Tony Calandro, who recently celebrated his 15th anniversary with the organization. Let's get connected. Welcome to the Season 1 finale of Connected. I'm Marisol. Today, we're reflecting on 15 years of growth and transformation at Healthy Connections. And the person who has had a front row seat to all of it, and often a hand in shaping it, is our CEO, Tony Calandro. Tony, thank you for taking the time to join us. Let's start at the beginning. When you think back to your first days here, what did Healthy Connections look like?
So, 15 years has flown by. It's been an interesting ride along the way. When I started, it was 15 years in October. When I started, we only had two clinics. We had the major clinic that our flagship operation is in Mina. At the time, it was about 16,000 square foot. Housed everything that we have currently today with medical, dental, outreach program, administrative offices. And our small office, which is still in existence in Mount Ida. And those are the two operations we had. Even more interesting, we only had like 34 or 35 full-time employees at the time.
A lot has changed since then. You grew up here, left the state for a while, built your career elsewhere, and ultimately came back. What brought you home?
Moved here when I was a kid, actually back in the 7th grade, moved to Hot Springs. What a great move for me and the family. Probably didn't realize it at the time. You never realize how good it is when you're a kid. But listen, growing up here was a great experience. I couldn't have asked for anything better. Got a chance to do things I probably would have never been able to do as a kid growing up. Having a boat, going to the lakes, having, going out fishing and hunting with my friends as I grew up. Went to college here in Arkansas, but like a lot of other young people, you got to find your way. And it led me to a lot of different places, moving back to St. Louis and growing up and working there, and then some stints in Boston, New York, Texas, Indiana. Been jumping around a little bit, but when I got the opportunity to come back to Arkansas, without hesitation. Great opportunity to do something, not just do something different, but to really make a contribution. And that's kind of what I saw Healthy Connections as. As a federally qualified healthcare center, that was an opportunity for me to kind of not just give back, but create something that could be looked at in the future as an opportunity for not just the employees that we have, but the communities that we're serving. And it's proved to be that and a whole lot more.
How about your alma mater, Lakeside, making it to the state championship this year in football?
So back when I was in school, we were part of the state championship as well. It's kind of a proud feeling knowing that your alma mater has done well. And I'd say they've done pretty well.
That's a great moment. Now, when you arrived at Healthy Connections, growth was slow but intentional. What were those early priorities?
So one of the first things that I looked at was kind of strategically, what did we need to do in order for us to not just grow, but to be successful? The key was the success in long-term sustainability. Those were probably at the forefront of my mind. I wanted to make sure that what we put into place was going to be here for quite some time, and at the same time that we could count on the folks that were coming on board. The dedicated employees, the staff that continue to work hard day in and day out, looking for those attributes that would make us stand apart from everybody else and give us a chance to continue to grow. So in the beginning, it was slow. It was more about trying to make our way, find the right components for us to grow, find the right geographical areas, the cities that were welcoming enough for us to be part of, and the communities where we thought we would be able to make a difference. And for us, it was about making a difference.
You've built a strong foundation, and what came next was a period of real momentum. Before we get into that next chapter, we're going to take a quick break. Stay with us. We'll be right back. same fight plays out. The flu steps into the ring, ready to take its shot. It's fast, unpredictable, and always looking for a weak spot. But this time, you're ready to fight back. Your flu shot is your best defense, your chance to knock out the flu. Appointments and walk-ins are available now at Healthy Connections. There's no cost with most insurance plans. Step into the ring and knock out the flu. Learn more at healthy-connections.org/flu.
When it comes to your health, silence isn't strength. Clarity is. Respect yourself by getting real answers instead of guessing. At Healthy Connections, checking your status is fast, confidential, and judgment-free. Knowing the truth helps you protect your future and the people who depend on you. Respect yourself. Walk in or schedule your confidential test today. Call 888-710-8220 today.
Welcome back to Connected. I'm here with CEO Tony Calandro, reflecting on his 15 years of leadership at Healthy Connections. Before the break, we talked about the early foundation. Now I want to look at the transformation that followed. Tony, Healthy Connections grew significantly, even during COVID, when many organizations faced major challenges. What allowed us to move forward during that time?
I think that what I've looked at is strategic growth. And it's not just in it's not just in bringing on new services or new elements to the company. It's about taking what we currently have and basically creating a more fundamental foundation. And that's where we kind of began. The growth has been exceptional. The first, when we got into the middle of our trend, of an upward trend, I would say starting in about 2017, we started moving up. We grew for that next 5 years, we grew at 62.5%, which is pretty incredible. Even through what I would consider those down years for COVID and all the other things that a lot of other people were experiencing, we still grew at over 35-36%. So those were still uptick years for us. And I think that one of the ways that we got there was paying real close attention to what the services were that were going to benefit the community and the patients that we currently serve.
Part of that was bringing care into communities, rather than making people travel long distances. Why was that so important?
When you look at Mina is a great example. It's an hour and a half from just about everywhere. It's an hour and a half from Hot Springs. It's an hour and a half from Fort Smith. It's an hour and a half from Texarkana. But when you talk to the patients, they don't really want to drive an hour and a half to go have services delivered. So we took that as a chance to say, what can we bring and keep in-house for the patients without them having to worry about travel and accommodations to get to those locations, going to Little Rock or whatever the case might be. And so that was one of the linchpins for trying to figure out, how do we bring services back to the community, keeping patients at home and not necessarily traveling a great distance to be able to have those services delivered to them.
A major part of Healthy Connections today is the full cycle of care: pediatrics, OBGYN, primary care, dental, behavioral health, and more. Why was that comprehensive approach necessary?
I think that it was important to be able to cover the cycle, if you will, recognizing that when we have patients, they usually come with families, whether it's grandma and grandpa or it's the kids. And we're here to deliver care and not necessarily to just one group. And the idea is, how can we be able to, or how do we continue to service everybody in the family? And that's every generation that comes through. And the idea is, how do we deliver all the services? Recognizing that, and I think that everybody saw that during COVID, behavioral health became a top product or service for everybody. Dental is another one. People on a daily basis need routine dental health care, and this is one of the chances for us to be able to deliver that service.
One of the biggest expansions recently has been pharmacy services. Why did you feel this was the right time?
A handful of years ago, we decided that pharmacy services would be a benefit to our patients. not knowing exactly what that landscape was going to look like, we didn't want to dig in too deep until we got a better understanding of how that was going to reflect for our patients. So we partnered with another company in the very beginning, a company that basically has been in the pharmacy business for years, Cardinal Health. And watching them over the last handful of years with the ups and downs of the industry and the business, we finally made the decision that it's important enough for our patients to have access to the pharmacy services. So we've incorporated that within our operation. Once we had a handle on being able to observe a little closer on what that looks like under our watchful eye and making sure that we were able to manage it the way we wanted, we decided that that was one of the areas we wanted to expand on and basically take to the next level. So with the support of the board of directors, we've decided to start opening additional pharmacies. So we have the one pharmacy operation in Neenah, but that is the first of many to come. The next pharmacy to open for us will be the one in Malvern. Although we're set up and ready to go, it's taken a little time to get software product and all the other things that we needed to initiate that. But that one should open here shortly, right after the first of the year. And then we're looking at two other options right now for additional pharmacies here in the near future, with the intention of trying to get those open in 26.
And looking ahead, what's next for Healthy Connections?
So we've got some interesting plans coming up for 2026. One of the newest ones, or newest additions that we plan on introducing, is a men's health program. We've had the women's health program. It's grown over the last handful of years. The expectation is we want to do the exact same thing with the men's health program. So the men's health program will kick off in 26. Some great creative advertisement and creative work around that one, which is going to be incredible. I think people are going to be surprised to the efforts of our marketing department that's jumped in with both feet to make this one really something surprising. And then we're gonna really work on promoting more of our pharmacy operations, especially given the fact of where that's headed. We have some other plans. We want to continue to grow some of our infectious disease programs. I think that the way to do that is to work on what the base has been. We'll expand that, and then we're keeping our fingers crossed that we're looking at potentially a new mobile unit sometime in 26. With that in its efforts, we'll be able to reach out to other areas that we quite haven't been able to reach out to yet, but this will be our chance to get out there, especially in some of the more remote areas that we don't actually touch with a clinic right now.
Tony, before we close out Season 1, I'd love for you to share your Christmas message with our employees and our communities.
So Merry Christmas to everybody and a Happy New Year to everybody. I think it's important to recognize the fact that over the course of the year, we've had some really serious dedicated staff that's helped us be successful throughout the year. And I think it's proven in the fact of how well the company's been able to do. And so it's the work and the hard work of all of our employees is appreciated. I think the message for the new year is we're not going to get bored. We're going to have a lot of new things coming out, new areas for us to venture into, and giving us a chance to expand our wings a little bit further and a little bit broader. So I think there's some exciting times coming. I know that we've seen some transformation over the last, we'll call it the last 5 years. I think the next 3 to 5 years will prove to be just as exciting as the 5 years prior to.
Tony, thank you for joining us and for your leadership these past 15 years. And thank you to all our employees, patients, and communities who make Healthy Connections what it is. If you need care, we're here for you. Schedule an appointment by calling 888-710-8220 or visiting healthy-connections.org. Connected will return in January with Season 2. New guests, new stories, and more conversations about community, compassion, and excellence. From my family to yours, Merry Christmas and Happy Holidays. Stay healthy and stay connected.